What if you could reduce joint pain and arthritis inflammation as effectively as ibuprofen, without relying on daily painkillers? For millions of people living with arthritis, joint stiffness, and chronic pain have become part of everyday life. While over-the-counter anti-inflammatory drugs like ibuprofen can offer quick relief, long-term use is linked to stomach irritation, kidney strain, and cardiovascular risks. That's why researchers have been exploring natural, science-backed supplements that work on the same inflammatory pathways, without the harsh side effects. In this video, we break down the top 3 supplements proven to work like ibuprofen by targeting prostaglandins, calming inflammatory enzymes, and supporting joint tissue repair. These aren't internet myths or wellness trends. Each supplement is backed by clinical research and real-world results. Stay with us, because one of these may already be in your supplement cabinet, and you might not be using it correctly for maximum arthritis relief. Let's move. Number 1, ginger. Ginger has been used as a medicinal root for over 5,000 years. Ginger works remarkably similar to ibuprofen when it comes to reducing joint pain and inflammation. For people suffering from arthritis, especially osteoarthritis and rheumatoid arthritis, ginger is one of the most well-researched natural anti-inflammatory supplements available today. Its power lies not in masking pain, but in targeting the same inflammatory pathways responsible for swelling, stiffness, and joint degeneration. The primary reason ginger is so effective for joint pain is its rich concentration of bioactive compounds, especially gingerols, shogales, and pyridols. These compounds have been shown in multiple studies to inhibit cyclooxygenase COX and lipoxygenase LOX enzymes, the same enzymes targeted by nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen. COX and LOX enzymes are responsible for producing prostaglandins and leukotrienes, chemical messengers that drive inflammation and pain in arthritic joints. By suppressing these enzymes naturally, ginger reduces inflammation at its source rather than simply dulling pain signals. One of the most important advantages ginger has over ibuprofen is safety with long-term use. While ibuprofen can irritate the stomach lining, increase bleeding risk, and strain the kidneys when used regularly, ginger has been shown to protect the gastrointestinal tract. In fact, ginger promotes digestion, improves gut motility, and reduces gut inflammation, an important benefit because emerging research shows a strong connection between gut inflammation and joint inflammation. A healthier gut environment can lead to reduced systemic inflammation, which directly benefits people with arthritis. Clinical studies support ginger's effectiveness for arthritis pain. In randomized controlled trials involving people with osteoarthritis of the knee, ginger extracts significantly reduced pain, stiffness, and difficulty with movement compared to placebo. Some studies found ginger to be comparable to ibuprofen in pain reduction, but with fewer side effects. Participants using ginger also reported improved joint function and reduced reliance on pain medication over time, suggesting that ginger may help manage arthritis more sustainably. Another critical way ginger supports joint health is through its antioxidant activity. Arthritis is not only an inflammatory condition, but also a disease of oxidative stress. Free radicals damage cartilage cells, accelerate joint degeneration, and worsen pain over time. Ginger's antioxidants neutralize these free radicals, protecting cartilage and synovial fluid from damage. This is particularly important for osteoarthritis, where cartilage breakdown leads to bone-on-bone friction and chronic pain. Ginger also plays a role in modulating the immune system, which is especially relevant for rheumatoid arthritis. In autoimmune arthritis, the immune system mistakenly attacks joint tissue, leading to severe inflammation and joint destruction. Research suggests that ginger can reduce the production of inflammatory cytokines such as TNF-alpha, IL-1 beta, and IL-6, which are heavily involved in autoimmune joint inflammation. By calming this immune overreaction, ginger may help slow disease progression and reduce flare-ups. Beyond inflammation control, ginger improves blood circulation, which is essential for joint repair. Healthy circulation ensures that oxygen and nutrients reach joint tissues, while metabolic waste is removed efficiently. Poor circulation is associated with increased stiffness, slower healing, and heightened pain sensitivity. Ginger's warming effect and vasodilatory properties help improve blood flow to affected joints, supporting recovery and reducing stiffness, especially in cold weather or early morning hours. Ginger's benefits extend to muscle health as well, which is often overlooked in arthritis management. Tight or inflamed muscles surrounding painful joints can increase joint stress and worsen pain. Ginger has been shown to reduce exercise-induced muscle soreness and muscle inflammation, helping relieve secondary pain that contributes to overall joint discomfort. Relaxed, well-functioning muscles reduce pressure on joints, improving mobility and daily function. When used as a supplement, ginger is available in several forms, including capsules, powders, extracts, and teas. Research suggests that standardized ginger extract providing 500 to 1,000 milligrams per day is effective for reducing arthritis pain and inflammation. Consistency is key. Unlike ibuprofen, which provides rapid but temporary relief, ginger works gradually. Most people begin noticing improvements within 2 to 4 weeks of regular use, with continued benefits over time. Fresh ginger can also be included into the diet for added support. Adding ginger to smoothies, soups, teas, or meals enhances daily anti-inflammatory intake. However, therapeutic doses are often easier to achieve with supplements, especially for individuals with moderate to severe joint pain. Combining ginger supplementation with an anti-inflammatory diet and healthy lifestyle further amplifies its effects. Another major advantage of ginger is its ability to work synergistically with other supplements. Ginger pairs well with turmeric, curcumin, omega-3 fatty acids, and boswellia, enhancing overall inflammation reduction without increasing side effects. This makes it a cornerstone supplement in many natural arthritis management protocols. It's important to note that while ginger is safe for most people, those on blood-thinning medication should consult a healthcare provider before using high-dose ginger supplements, as ginger has mild blood-thinning properties. For the vast majority of people, however, ginger is well tolerated and far safer than long-term NSAID use. In conclusion, ginger stands out as one of the most scientifically validated natural alternatives to ibuprofen for joint pain and arthritis relief. By targeting inflammatory enzymes, reducing oxidative stress, calming the immune response, improving circulation, and supporting muscle and joint function, ginger addresses arthritis pain at multiple levels. It doesn't just relieve symptoms, it supports the body's natural healing processes. For anyone looking to manage joint pain naturally, safely, and effectively, ginger is not just a traditional remedy. It is a research-backed, modern solution. Drop a comment below. Which of these supplements are you most excited to try for joint pain, ginger, bromelain, or ASU? Number 2. Bromelain. Bromelain is a powerful natural enzyme complex derived from the stem and juice of pineapple and has gained significant scientific attention for its ability to reduce inflammation, relieve joint pain, and support arthritis management in a way similar to ibuprofen. Different conventional pain relievers that simply block pain signals, bromelain works at the root of inflammation by influencing immune response, swelling, and tissue repair. For people struggling with arthritis, joint stiffness, or chronic inflammatory pain, bromelain stands out as one of the most researched and effective natural supplements available. In arthritis, inflammatory proteins accumulate in joint tissues, leading to swelling, pain, and reduced mobility. Bromelain helps break down these proteins, allowing the body to clear inflammatory debris more efficiently. This enzymatic action reduces swelling in joints and surrounding tissues, which directly translates into less pain and improved range of motion. One of the most important ways bromelain works like ibuprofen is through its effect on prostaglandins, the chemical messengers responsible for pain and inflammation. Research shows that bromelain can reduce the production of pro-inflammatory prostaglandins while increasing anti-inflammatory ones. Ibuprofen achieves pain relief by blocking prostaglandin synthesis through COX enzyme inhibition, but bromelain does this more gently, without suppressing protective prostaglandins needed for stomach and kidney health. This makes bromelain especially valuable for people who cannot tolerate NSAIDs due to gastrointestinal or cardiovascular side effects. Clinical studies have demonstrated bromelain's effectiveness in osteoarthritis, particularly of the knee. In several trials, bromelain supplementation significantly reduced knee pain, swelling, and stiffness while improving physical function. Some studies even found bromelain to be comparable to standard NSAIDs in pain relief, but with better tolerability and fewer adverse effects. Participants taking bromelain were able to walk more comfortably, experience less morning stiffness, and reported improved quality of life. Another critical benefit of bromelain is its ability to reduce swelling and fluid buildup around joints. Swelling is a major contributor to arthritis pain because it increases pressure within the joint capsule, irritating nerves and limiting movement. Bromelain enhances the body's natural fibrinolytic activity, meaning it helps break down fibrin, a protein involved in swelling and scar tissue formation. By reducing excess fluid and fibrin buildup, bromelain helps joints move more freely and comfortably. Bromelain also plays a significant role in modulating the immune system, which is especially important for people with inflammatory and autoimmune forms of arthritis, such as rheumatoid arthritis. Research suggests that bromelain can reduce the migration of inflammatory immune cells to joint tissues and decrease levels of inflammatory cytokines like TNF-alpha, IL-1 and IL-6. These cytokines are heavily involved in joint destruction and chronic pain. By calming immune-driven inflammation, bromelain may help reduce flare-ups and slow disease progression. Another often overlooked benefit of bromelain is its positive effect on circulation and tissue healing. Bromelain improves blood flow by reducing platelet aggregation and supporting healthy circulation. Better circulation means more oxygen and nutrients reach damaged joint tissues, while waste products are removed more efficiently. This supports faster recovery, reduced stiffness, and improved joint resilience over time. Improved circulation is particularly beneficial for older adults, whose joint healing capacity naturally declines with age. Bromelain's antioxidant properties further enhance its joint protective effects. Oxidative stress accelerates cartilage breakdown and worsens inflammation and arthritis. Bromelain helps neutralize free radicals and reduce oxidative damage in joint tissues, protecting cartilage and connective tissue from further degeneration. This makes bromelain useful not only for symptom relief, but also for long-term joint preservation. When it comes to supplementation, bromelain is most effective when taken on an empty stomach. Taken with meals, bromelain primarily aids digestion, but taken between meals, it enters the bloodstream and exerts its systemic anti-inflammatory effects. Research-backed dosages typically range from 500 to 1,000 milligrams per day, divided into 2 or 3 doses. Consistency is essential. Most people notice improvements in joint pain and swelling within 2 to 3 weeks, with continued benefits over longer periods. Bromelain is often used in combination with other anti-inflammatory supplements, such as turmeric, curcumin, ginger, or boswellia. These combinations work synergistically to target inflammation from multiple pathways, often allowing people to reduce or avoid NSAID use altogether. This makes bromelain a cornerstone supplement in many integrative arthritis management protocols. In result, bromelain is one of the most scientifically supported natural alternatives to ibuprofen for joint pain and arthritis relief. By reducing inflammatory proteins, modulating prostaglandins, calming immune responses, improving circulation, and protecting joint tissue, bromelain addresses arthritis pain at multiple levels. It offers meaningful pain relief without the long-term risks associated with NSAIDs. For individuals seeking a natural, effective, and research-backed solution for joint inflammation and arthritis discomfort, bromelain is not just a supplement. It is a powerful therapeutic tool that really helps support the channel. Tells YouTube to share this video with others who need joint pain and arthritis relief, and lets us know you want more science-backed health content like this. Your one click makes a big difference. Thank you for support. Number 3, Avocado-Soybean Unsaponifiables, ASU. Avocado-Soybean Unsaponifiables, commonly known as ASU, are one of the most clinically researched natural supplements for joint pain, osteoarthritis, and arthritis-related inflammation, and they work in a way that is often compared to ibuprofen, without the same long-term risks. ASU is not a vitamin or a painkiller. It is a unique extract made from the unsaponifiable fractions of avocado and soybean oils. These fractions contain powerful bioactive compounds that directly influence cartilage health, inflammation, and joint structure, making ASU especially effective for long-term joint protection and pain relief rather than just short-term symptom masking. What sets ASU apart from many other supplements is its ability to target the root causes of osteoarthritis, particularly cartilage breakdown and chronic low-grade inflammation. In arthritis, inflammatory chemicals such as prostaglandins, nitric oxide, and cytokines gradually destroy cartilage, reduce joint space, and lead to pain, stiffness, and loss of mobility. Research shows that ASU helps inhibit inflammatory mediators, including IL-1 beta, TNF-alpha, and COX-2, pathways also targeted by NSAIDs like ibuprofen. However, instead of blocking these pathways aggressively, ASU modulates them gently, reducing inflammation while allowing the body's natural repair mechanisms to function. One of the most important and unique benefits of ASU is its ability to stimulate cartilage regeneration and protect existing cartilage. Many other ibuprofen, which only reduces pain and swelling, ASU has been shown to increase the production of collagen and proteoglycans, key structural components of cartilage. These molecules give cartilage its cushioning and shock-absorbing properties. By supporting cartilage synthesis and slowing cartilage degradation, ASU doesn't just reduce pain, it helps preserve joint structure over time. This is particularly critical for people with knee and hip osteoarthritis, where cartilage loss is the primary driver of pain and disability. Clinical trials strongly support ASU's effectiveness. Multiple randomized, double-blind, placebo-controlled studies have shown that ASU significantly reduces joint pain, stiffness, and functional limitations in people with osteoarthritis. Many participants experience meaningful pain relief within 6 to 8 weeks, with continued improvement over several months. Importantly, studies also found that people taking ASU were able to reduce their use of NSAIDs, including ibuprofen, which highlights ASU's role as a safer long-term alternative rather than a temporary fix. Another key mechanism by which ASU works is by reducing inflammation inside the joint capsule, particularly in the synovial membrane. In arthritis, the synovial lining becomes inflamed and produces inflammatory fluid that increases pressure and pain. ASU helps normalize synovial cell activity, reducing excess inflammatory fluid and improving joint lubrication. Better lubrication leads to smoother joint movement, less friction, and reduced pain during daily activities, such as walking, climbing stairs, or standing for long periods. ASU also has notable antioxidant properties, which are essential in arthritis management. Oxidative stress accelerates joint degeneration by damaging cartilage cells and worsening inflammation. The bioactive compounds in ASU help neutralize free radicals, protecting joint tissues from further damage. This antioxidant effect complements ASU's anti-inflammatory action, making it particularly effective for slowing progression of degenerative joint disease rather than simply managing symptoms. Another advantage of ASU over ibuprofen is its excellent safety profile. Long-term NSAID use is associated with gastrointestinal bleeding, ulcers, kidney stress, and increased cardiovascular risk. ASU, on the other hand, has been shown to be well tolerated even with long-term use. In clinical studies lasting up to 3 years, ASU caused no significant adverse effects and did not negatively impact the stomach, kidneys, or cardiovascular system. This makes ASU especially suitable for older adults and individuals who require ongoing joint support. ASU is particularly effective for knee and hip osteoarthritis, but research suggests it may also benefit people with hand osteoarthritis and generalized joint stiffness. While it is not a fast-acting pain reliever like ibuprofen, ASU works gradually and cumulatively. Most people notice reduced pain and stiffness after 6 to 12 weeks of consistent use, with maximum benefits appearing after several months. This gradual onset reflects ASU's role as a disease-modifying supplement rather than a short-term analgesic. The most commonly studied and recommended dosage of ASU is 300 milligrams per day, taken with a meal to enhance absorption. Consistency is critical. Skipping doses reduces its effectiveness because ASU works by steadily influencing inflammatory and cartilage-building processes. ASU can be safely combined with other joint support supplements, such as glucosamine, chondroitin, omega-3 fatty acids, turmeric, or ginger, and these combinations often produce even better results. It is important to note that ASU is not intended to replace medical treatment for severe or advanced arthritis, but it can be a powerful complementary strategy. For people looking to reduce reliance on pain medications, slow joint degeneration, and support long-term mobility, ASU offers a science-backed option that addresses both pain and joint health simultaneously. In conclusion, Avocado-Soybean Unsaponifiables represent one of the most effective and well-researched natural alternatives to ibuprofen for joint pain and arthritis relief. By reducing inflammation, protecting cartilage, stimulating joint repair, improving lubrication, and offering excellent long-term safety, ASU stands out as a supplement that not only relieves symptoms but helps preserve joint function over time. For anyone serious about managing arthritis naturally and sustainably, ASU is not just an option. It is a research-supported cornerstone of joint health therapy so there you have it. 3 science-backed supplements that work like ibuprofen by targeting inflammation at its source, without the long-term risks of daily painkillers. Ginger helps block inflammatory enzymes. Bromelain reduces swelling and immune-driven inflammation, and Avocado-Soybean Unsaponifiables ASU go even deeper by protecting cartilage and supporting joint repair over time. The key takeaway is this: real relief doesn't come from masking pain. It comes from supporting your joints consistently and intelligently. These supplements work best when taken regularly, paired with an anti-inflammatory diet, gentle movement, and quality sleep. And while they're powerful, always talk to your healthcare provider if you're on medication or managing a chronic condition. If this video helped you, like, share, and subscribe for more evidence-based tips on joint pain and arthritis relief. Let us know in the comments. Which supplement are you most curious to try? Thanks for watching, and I'll see you in the next video.